Fernanda Andrade has struggled with her weight for as long as she can remember. Now she's on a diet once more, has enrolled in a gym, and has been going to meetings of Weight Watchers Brazil, the Vigilantes do Peso. Her feeling is that the number of people sharing her struggle has been growing over the years.
Olha, acho que eu posso dizer pela minha família.
I can tell from my family. When I was a child, I remember all my uncles and aunts were very thin. Now they are much fatter, with round faces.
Estimates from Brazil's health ministry confirm Fernanda's impression. Over 10 years, the number of obese people in Brazil went from less than 12% of the population in 2006 to almost 19% in 2016. That's an increase of 60%. Meanwhile, the number of people considered overweight but not medically obese went from less than 43% in 2006 to nearly 54% in 2016. The group facilitator at Weight Watchers says modern life has been taking its toll on people's health.
Nowadays, people have very busy lives. Rarely we see them having time to have proper meals around the table with their families. People have no time to cook, so they end up eating in restaurants and getting fast food. There's also delivery of all kinds of foods. These are things created to make our lives easier, but have had a negative impact on the health of Brazil's population.
Obesity is widely recognized as a risk factor for a number of health conditions, and its rise in Brazil is a serious problem, not only for individuals, but for the country's public health system as a whole.
The president of the Brazilian Association for the Study of Obesity says the government needs to come up with more regulatory and educational actions to deal with the problem.
If you look at the whole picture, this creates serious losses for the public health system, which is already under great pressure in Brazil. So an increase in demand caused by the increase in obesity-related conditions is like a time bomb that's ticking and will explode sometime in the future.
Meanwhile, many here are not giving up, choose instead to fight the good fight against obesity, however long it may take. Paulo Cabral, CGTN, São Paulo.